The purpose of my meeting is to ask you a few questions about my potential influenza. Can you explain that to me?
Of course, influenza, commonly known as the flu, is a highly contagious respiratory illness caused by influenza viruses. It can lead to mild to severe illness and in some cases can be fatal. Here are some key points about influenza. 1. Symptoms. Common symptoms include fever, chills, cough, sore throat, runny or stuffy nose, body aches, headaches, and fatigue. Some people may also experience vomiting and diarrhea, though this is more common in children. 2. Transmission. The flu virus spreads mainly through droplets made when people with the flu cough, sneeze, or talk. It can also spread by touching surfaces or objects that have the virus on them and then touching your mouth, nose, or eyes. 3. Prevention. The best way to prevent influenza is through vaccination. Annual flu vaccines are recommended to reduce the risk of infection and its complications. Other preventive measures include practicing good hygiene, such as washing hands frequently and avoiding close contact with sick individuals. 4. Treatment. Most people recover from the flu within a few days to less than 2 weeks without needing medical attention. However, antiviral medications can be prescribed to help lessen symptoms and duration if taken soon after symptoms start. 5. Complications. Influenza can lead to serious complications, especially in young children, elderly individuals, pregnant women, and people with certain health conditions like asthma or diabetes. If you have specific questions or concerns about influenza, feel free to ask.
Thank you. I also am interested to learn about meningitis. Can you explain that to me?
Certainly. Meningitis is an inflammation of the protective membranes, meninges, surrounding the brain and spinal cord. It can be a serious condition and is typically caused by infections, though it can also result from non-infectious factors. Here are some key points about meningitis. 1. Causes. Viral meningitis. This is the most common form and is usually less severe. It is often caused by enteroviruses, but can also result from other viruses like mumps, measles, or herpes. Bacterial meningitis. This is more severe and can be life-threatening. Common bacteria that cause bacterial meningitis include Streptococcus pneumonia and Neisseria meningitidis.
Thank you so much. I appreciate your time, doctor. Have a good day.
You're very welcome. I'm glad I could help. If you have any more questions in the future, feel free to reach out. Have a great day.
Thank you. Okay, now we are going to test another doctor. So what we are going to do, this is where we can put multi-specialties, for example, and then provide different set of knowledge. So with that in mind, we can click on her and then be able to present her with the questions and answers. So these rooms under HIPAA compliant allows you to provide telemedicine, connect them to telehearts, to devices, be able to cater to service, provide physicians knowledge as a service by the practitioners that they can provide that. And more importantly, they can go into explaining about nutrition, about scheduling an appointment, about things that we all could be providing addition of, such as facility, a three-dimensional tour of your location, your medical center, all of those things can be accommodated. Okay, so just wanted to give you a little demo on how we are planning to introduce WEBDR.AI to what we call uninsured market, where AI can become a source of preventive management, providing general knowledge. And then by clicking, for example, here to meet with a real doctor, you can schedule an appointment or meet with them online. Thank you for watching. Have a great one. Ciao. Cheers.